you are an abortion clinic that cannot perform abortions anymore. What does help look like?
So when people come to the clinic now, if they say that they want an abortion, we are able to provide them with a website that they can go to. It's called ineedana.com, and they can put in all of their information to find the next closest clinic that will be available. This is becoming more and more difficult, though, because we're seeing reports from Illinois, reports from Kansas, reports from Florida that clinics are backing up. It's taking 3-4 weeks for people to be able to get an abortion now. And we know that in Alabama that may be unsustainable for them. If they need prenatal care, if they need to be able to have a doctor verify a pregnancy in order to make sure that they can get onto Medicaid and get health care from anyone while they are pregnant, that's a thing that we can do. If they are continuing a pregnancy and they are worried about bleeding in any way, shape, or form, that's a thing that we can check on for them because the hospitals aren't doing this. And that's the thing that I hope that at some point the legislature understands, is that they aren't shutting down abortion clinics, they're overburdening hospitals that were already in crisis. In Alabama, most people are underinsured or not insured at all. Most people don't have doctors. Most people use their hospital as a primary care. They ignore whatever is their physical issue until the point where they can't ignore it anymore, and then they go into emergency rooms for help. That's how they get health care out here. And now you are taking away every person who would have had an abortion. You're taking away every person who is going to become pregnant. You are taking away every person who might be experiencing pregnancy complications, taking them away from us and sending them to a hospital system that already does not have enough doctors, enough care, does not have enough hours, because we, the people who could provide this preventative health care and who are experts at it, are being told, no, you're not allowed to do this anymore. And if you even so much as think about it, we're going to put you in jail for 99 years.
Let's discuss the logistics. Somebody comes in here, and there are two pieces of logistics that they have to consider: how far they are along in their pregnancy and where various states are in terms of allowing an abortion. And I don't know how much of this you're allowed to tell people under your very unclear Alabama laws now, but that could be the reality of somebody who walks into this clinic.
If they say, I want information about abortion, we cannot do that. If they say, where should I go to get an abortion, we cannot do that. If they come in and say, I had an abortion, can you help me? That's where things get really scary. We believe that if a person had an abortion, that we can follow up and find out if that abortion was successful. If there are complications and a non-viable pregnancy, we can address that. If there are complications such as it not working at all, we can help them discover how far along they are, and we can help them address prenatal care or other concerns. We believe, and so far we have not been told otherwise, that if there is no cardiac activity, or if we can prove that there is a non-viable fetus based on lab work that shows that HCG is declining, we can provide the necessary procedure in order to end that non-viable pregnancy. That's where we're at, and that's why we're here, because you can do that here, or you can go into a hospital and tell them that you are pregnant and bleeding. And so far, every patient that we have talked to who has done that has said that they have left the hospital at least once because no one has ever bothered to see them. Wow. Some of them have waited for 4 hours, 5 hours.
Nobody wants to touch this.
No, it's just hospitals are overwhelmed. Pregnant people in Alabama are such a low priority for healthcare in general that if you go into a hospital that has all of these pressing needs, they're going to put you aside because they figure it's just a pregnancy issue. It can wait.
We got months to deal with that.
I mean, exactly. And so they assume that it's not something that needs to be addressed immediately. They assume that there is no immediate health threat to a person. Maybe there's not an immediate health threat, but obviously there's a health threat in some way, shape, or form, but also it's basic dignity to not turn away somebody who is suffering and in pain. This is something that should be basic to all doctors. And we have a literal 6-inch thick pile of files that we've been compiling for the 2 years that we have been here that are doctors that have turned away patients or miscarried for patients in hospitals all over this state and all over Mississippi. And we are keeping track of it. And it's something that with the shackles taken off of us, because there is no more threat when it comes to keeping our license to provide abortion, it's something that we are going to go through and that we feel we should share at some point. We want people to understand that there are doctors in this state who make people pregnant. They make people pregnant because they see pregnancy as a punishment. It is a punishment for not following their guidance or doing what it is that they say that the patient should do. We had a patient who came in pregnant because she wanted an IUD from her doctor after she delivered, and the doctor said, if you don't want to be pregnant, you should be sterilized. And of course, this was a black woman. And she said,
Somebody told a black woman in this day and age in Alabama that she should be sterilized.
Yes. And so she said, I might want children in the future. I just don't want any more children right now. And he refused to give her an IUD. And 3 months later, she was pregnant and in our clinic having an abortion.
Miscarriages, pregnancy complications. That issue has become more complicated now in a lot of states like Alabama, where a woman who is bleeding and who might think there's something wrong with her pregnancy now has an added thing she has to think about whether or not this is going to seem like an abortion if she loses her pregnancy. What happens when somebody comes into this clinic now? Because you can see those people.
We can see any person who is pregnant and bleeding. Again, our rules are if there is any sort of clue that there's viability, if there's cardiac activity, there is nothing more we can do other than offer prenatal care. That is it. But we also know that there are going to be people who either are going to try to miscarry. We also know that there is no health care preventatively out here. And when you have pregnancies that are mistimed or pregnancies that come too close together or pregnancies from people who do not have health care to start with, those are unhealthy pregnancies that have a very high possibility towards miscarriage as well. So we have the procedure and have the mission of not asking people what happened. You are pregnant, you are bleeding, you're worried about your pregnancy, we will help you. We're not going to ask if you took something, we're not going to ask if you've been doing drugs, we're not going to run blood tests in that way, we are not going to investigate you, we are just going to give you care because that's what doctors need to do.